Hi friends, once again good evening. Welcome to my channel Mogambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. Also these questions will helpful for your other nursing officer exam preparation. In the previous video we discussed important MCQ section first part. We can continue important MCQ questions. First question, which part of pancreas produce and secrete insulin? Options, option A glomerulus, option B Bowman's capsule, option C islets of Langerhans, option D loop of Henle. Here this question, first option glomerulus, option B Bowman's capsule and option D loop of Henle. All are the part of kidney. It is not the part of pancreas. So here the correct answer is option C islets of Langerhans. Pancreas has both endocrine and exocrine functions. In the endocrine pancreas, the glands are having a group of specialized cells called pancreatic islets or islets of Langerhans. The function of this endocrine pancreas or these islets of Langerhans is to secrete hormones like insulin and glucagon, which are primarily concerned with control of blood glucose. So the islets of Langerhans which secrete insulin and glucagon. So the correct answer is option C. Move on to the next question. Normal range of T4 hormone, T4 or tetraiodothyronine. Options, option A 5.4 to 11.5 microgram per deciliter, option B 75 to 195 nanogram per deciliter, option C 0.2 to 0.5 nanogram per deciliter and option D 0.5 to 5 milli international unit per liter. Question, normal range of T4 hormone. T4 is thyroxine or tetraiodothyronine. Normal value is 5.4 to 11.5 microgram per deciliter. Option A is the correct answer. That is the normal range of T4. And the second option, option B 75 to 195 nanogram per deciliter. That is the normal value of T3. T3 is triiodothyronine. And option C 0.2 to 0.5 is the normal value of free T3. And option D 0.5 to 5 milli international unit MIU per liter, that is the normal value of TSH. Okay, here T3 normal value is there, T4 is there, TSH normal value is there and also free T3 normal value is there. On to the next question, which examination is done to confirm TB meningitis? Options, option A sputum examination, option B spinal tap, option C CSF examination, option D lumbar puncture. Question, which one is the confirmative test for TB meningitis? And the correct answer is it is CSF or cerebrospinal fluid examination. Option C is the correct answer. Move on to the next question. A client is admitted to the hospital in sickle cell crisis. For which clinical indicator should the nurse monitor the client? Options, option A pain, option B diarrhea, option C bradycardia, option D blurred vision. Here the question is, a patient or a client is admitted in a hospital with the diagnosis of sickle cell crisis. So as a nurse, what she should monitor for this client? That is the question. So here the correct answer is option A. Pain is the first assessment for a patient with sickle cell crisis. Sickle cell crisis, we can see there are three types of sickle cell crisis in adult population. In that, the most common one is the painful sickle cell crisis. That is our question. So we have to assess the pain. So that is the most common type. The most common is very painful sickle cell crisis which result from tissue hypoxia and necrosis due to inadequate blood flow to a specific region of tissue or organ. And the second one is aplastic crisis which result from infection. Okay, and with human parvovirus, infection with human parvovirus, the hemoglobin level falls rapidly and the marrow cannot compensate as evidenced by an absence of reticulocyte. This is the second type, aplastic crisis. And the third type is sequestration crisis, result from other organ pool in the sickle cells. On to the next question. Which of the following anti-diabetic drugs can cause vitamin B12 deficiency? Options, option A glipizide, option B acarbose, option C metformin, option D pioglitazone. And the question is, which anti-diabetic drugs can cause vitamin B12 deficiency? And the correct answer is, it is metformin. Option C is the correct answer. Move on to the next question. A jerky pulse with full expansion and sudden collapse is seen in options. Option A, collapsing pulse. Option B, Corrigan's pulse. Option C, running pulse. Option D, bounding pulse. Here the question. Full expansion and sudden collapse. Sudden collapse is seen in case of Corrigan's pulse. Option B is the correct answer. Important one point, most commonly taking pulse or most commonly we are checking pulse is radial pulse, and in an emergency situation immediately we are checking the carotid pulse of the patient. Okay, here a jerky pulse with full expansion and sudden collapse is seen in Corrigan's pulse. And the next question, a nurse is caring the birth of a newborn. Which nursing action is most effective in preventing heat loss by evaporation? Options. Option A, warming the crib pad. Option B, closing the doors to the room. Option C, drying the infant with a warm blanket. Option D, turning on the overhead radiant warmer. The question is, a nurse is caring a newborn. Among this option, which is the effective method to prevent heat loss by evaporation? And the correct answer will go option C, drying the infant with warm blanket. So immediately after delivery, we are drying or we are cleaning the baby with warm blanket. That's why water will go from the body, that is heat loss by evaporation. And the first option, warming crib pad. Using crib pad means conduction, heat loss by conduction. And second option, through closing the doors means we can lose convection method. Okay, heat loss occurs through convection. And turning the overhead or radiant warmer means through radiation. Okay. Move on to the next question. A client is prescribed prolonged bed rest after surgery. Which complication does the nurse expect to prevent by teaching this client to avoid pressure on the popliteal space? Options. First option, cerebral embolism. Option B, pulmonary embolism. Option C, dry gangrene of a limb. Option D, coronary vessel occlusion. Here the question is, a patient is advised for a prolonged bed rest after a surgery. The question, which complication can occur for this patient and how the nurse can teach the client to prevent the occurrence of such complication. Especially if we are giving prolonged bed rest, there will be pressure on the popliteal space. So how the nurse will teach the patient to prevent the occurrence of this complication? That is the question. So if we are providing continuous bed rest and not moving, there may be chance of occurrence of small embolus or small blood clot in the cuff vein. That may lead to pulmonary embolism. So as a nurse, she should or he should teach the client to move as far as the patient can do. Okay, so thereby we can prevent the occurrence of complication. So here the correct answer is option B, pulmonary embolism. And the next question, a 6-year-old child with cystic fibrosis has an order of pancreatic replacement. The nurse knows that the medication will be given. Options. Option at bedtime. Option B, with meals and snacks. Option C, twice daily. Option D, daily in the morning. Here the question is, a 6-year-old child with the diagnosis is cystic fibrosis and has an order of pancreatic replacement. It's an organ transplantation surgery. Here our question is, the nurse knows that the medication will be given at what time? How the medication can give to the patient? That is the question. Cystic fibrosis means it's one of the chronic multisystem disorder, that is autosomal recessive trait disorder, which is characterized by exocrine gland dysfunction. Organ transplantation is one of the option to increase the survival rate in this case. So here the medication can give along with meals and snacks. Option B is the correct answer. Not on the bedtime or not on twice daily or daily in the morning, but we can give medication with meals and snacks. Option B is the correct answer. Important MCQ section we are discussing. In the next video we can see next question.